treatment plan for the movie The Three Faces of Eve. So let's start. First would be the personal information. So the client's name is Eve White. She's 27 years old, female, from Georgia, USA, and she's currently married. Next is psychological history. So the client, Mrs. White, was initially brought to the Medical College of Georgia University for a consultation with psychiatrist Dr. Curtis Luther. It was actually her husband who brought her to the university, to the medical college. So it was because the husband reported that there were odd behavior that Mrs. White exhibited. So first there was a purchase of several items from the mall, and then there was also a time that she choked her child, dear child, and then she denied both allegations after doing this. So Dr. Luther reported that on follow-up consultations, there appeared two distinct personality traits. This actually led to my diagnosis. To my diagnosis. So as you can see here, my diagnoses are dissociative identity disorder (DID) and post-traumatic disorder. So why I placed DID and PTSD as comorbids and not PTSD with dissociative features? There is a very strong link between trauma, especially childhood abuse and or neglect, and dissociative disorders, and the relationship is important in both directions. It's thought that long-term trauma is a root cause of dissociative disorders, with dissociation occurring as a coping strategy that allows people to distance themselves from trauma that may otherwise be unbearable. Also, it is highlighted in the movie that Eve White has two personality traits. They named them Eve Black and Jane. So this actually led to my diagnosis of DAD, DID, and PTSD. So next, fortunately, when recognized, recovery from dissociative disorders and PTSD is actually possible. It frequently includes a combination of psychotherapy, in this case or in this treatment plan is CBT, and medications. So I divided my treatment plan into two main goals. First would be focusing on the client, in our case Mrs. White, and the second one focuses on the client's social network, or her husband, her daughter, the family, and the community. So my first treatment goal will be the client's symptoms of DID and PTSD will be significantly reduced. So how are we going to achieve this goal? So let's have our objectives. First objective, the client will develop rapport with the therapist. This will be measured by how she answers questions in the therapy and her level of cooperation with the therapist. So I'm assuming uh, the establishment of the treatment plan is February 6th, but at least February 20, we have already achieved this objective. So therapeutic rapport is an essential part of a healthy therapist-client relationship, leaving the client feeling safe and respected so that the therapy can be successful. With good therapeutic rapport, a client feels their therapist has their back in a way that allows them to face difficult to face problems. So next, the client will be involved in at least one social event in the community. The therapist may identify irrational beliefs and encourage the client to engage in activities that will counter health self-defeating belief. So again, the completion date is at least 2 weeks before the date of after the date of establishment. Next, the client will learn how to tolerate uncomfortable feelings and or memories without having negative affects nor cognition when confronted by the stressor. So although it requires a few sessions, it's gonna require a few sessions as we all know. When a person with DID and PTSD has a negative thought about the world, the CBT approach is beneficial to change their thinking. It can help the client to identify and cope with specific challenges. Our thinking patterns are found out in childhood and become automatic and comparatively fixed. So applying this in our client, the traumatic event happened when Eve was 6 or 7, and now she's 27, and then the signs and symptoms of the AD and PTSD are appearing. So that's what we mean when we have the childhood patterns, when uh, the thinking patterns of Eve when she was 6 or 7, it was developed there. It became automatic and comparatively fixed. Next, the client will learn to identify maladaptive thoughts or negative thoughts and how to replace them with more positive and adaptive thoughts. So it's actually predicated from CBT, wherein it's not the events themselves that upset the client or upsets us, but the meanings we give them. Our thoughts become too negative that it blocks us seeing things or doing things that don't fit, that disconfirm what we believe is true. Next objective. So the client will identify 3 areas of interest and strength and become or continue to be involved in activities that utilize her strengths. Actions, thoughts, emotions are all connected to our mental health. So CBT works on changing our thoughts and actions. So those are the objectives on how can we achieve our first treatment goal. So our next treatment goal will be focusing on the social or occupational impairments of the client. So the client will be able to increase social interactions with family and other close individuals. So how are we going to achieve this? First objective, the client will be able to join family activities scheduled by her husband. So since our objectives must be measurable, so we can by this objective we can ask how many activities that you set, or we can ask the husband how many activities that you set, and then he was able to join. And then from there, we rate or we review if it's we have accomplished or we have completed this objective. Next, the client and her husband and other family members will be able to develop communication skills. Again, we start from the closest network or closest social network from the husband and now the family. So if we can ask them what are the skills that you have developed communication skills that you have developed in the family that made the communication between the husband, the daughter, and Eve better. And lastly, the client will be able to participate in 2 community events and join at least one social group. Again, from this smallest unit, the family, and now going out to the community. So that's it. That's my treatment plan for the movie The Three Faces of Eve. Thank you.